I had gum problems, bone loss, and the teeth kept failing.
He had multiple areas of decay, gum disease that he's been spending money without end for many years, to the point that he was sick and tired of being sick and tired, basically. And I mentioned this option to Michael. Michael said, "You mean after the surgery it's not going to move?"
And the doctor told me about this new FixedSecure solution. I said, okay, let's go for it.
Once we placed the implants and we gave him the FixedSecure option, life was a different ball game for him.
FixedSecure is a treatment modality that allows patients to obtain a full arch of teeth that does not come in and out, which we know is a non-removable appliance.
So we actually did the surgery, everything went well, and Michael left with the dentures in place.
The way that it adheres to the mouth is not with any conventional screws, as in some of the other techniques that are out there. It relies on a snap and rigid fixation mechanism in which the teeth are non-removable to the patient.
I like to eat. I like food. Corn on the cob, cooked on the grill, and a little butter, salt. Man, I'll tell you, it's heaven, because I hadn't done it in so long. Could not do that before without the FixedSecure in place. It's a whole game changer. You just forget you have them sometimes, and that's a good thing.
So the benefits of FixedSecure are twofold. For the patient, it's a less cumbersome and less invasive surgical procedure. When any arch is restored with a full mouth of teeth, a certain layer of bone polishing is reduced. So therefore, the level of invasiveness of the surgical element is diminished. Secondly, from an affordability standpoint, the ability to obtain teeth that aren't removable at a price point that they can afford, they're able to get non-removable teeth now without having to pay a fee of $20,000 or more, is something that our profession has never seen, and it's something that both the patients and the doctors are very, very excited about.
For this, because it feels very solid, feels very secure, and it looks good. When I got the FixedSecure, wow, what a new life, and it's fantastic.
The next is time. The time it takes for the procedure to be performed and for the procedure to be restored is a fraction of that of our conventional screw-retained fixed full arch dentistry. So one of the most exciting differentiators about FixedSecure is the ability for those that are already in a snap-on denture to transition into this treatment. It doesn't have to be an all or none. So with the demands of the economy or the personal financial situation of the patient, they're able to take steps in the process rather than having to be overwhelmed with a large price tag at the end of the tunnel. So the ability for us to go from a removable to a fixed appliance is something that has been very, very impactful and powerful to the patients.
It just changes your whole life. I mean, I wouldn't smile before. You wouldn't see my lower teeth. And now I can smile, I open my mouth, and I don't feel ashamed. Yeah, it's made my life a lot better, and made me a lot happier.